So what happens when a surgeon makes a mistake or has a complication in surgery? In this video today, we're going to talk about that. What's up, guys? My name is Dr. Webb. I'm an orthopedic spine surgeon here in San Antonio, Texas. So I get a lot of questions from people from all over the world. One of the most common questions, or question that I see quite frequently, is have you ever made a mistake as a doctor or as a surgeon? And some people, have you ever had complications? Well, I will tell you this. Any surgeon that tells you that they don't have complications is either number one, they're telling a lie. Number two, they're not doing enough surgery. Surgery has a lot of risks associated with it. And you could do everything in your power, in your might, use your training and your knowledge, go to the top schools, top training, do everything perfectly, and a patient still has a complication. There are certain conditions, diabetes, certain malabsorption disorders that affects the healing process. Patients who have very severe, in my case as a spine surgeon, stenosis or problems, which is essentially narrowing of the spinal canal. And you're doing these really complex surgeries and you're working around really delicate structures like the spinal cord or nerves that are sometimes not very forgiving. If a patient has a fracture, I can hit their bone just like this right here with a mallet, just hit it. That patient will do fine. If I do the same thing in a patient to their spinal cord, especially in the cervical spine, you can paralyze them. That's the reason why spine surgery, it's a very stressful career field. It has a lot of responsibility. The risks are really high, but I knew that going into it and I decided to take the leap of faith. I have to take those risks. And we had discussions with patients about it in surgery, before surgery, after, and hopefully their condition, their level of impairment or pain, loss of function is severely impacted to a point where they're willing to take those risks. Well, complications do happen in surgery. Mistakes do happen. I've seen it over and over again throughout my training. That's why they call it practicing medicine. In order to get good at something and be really efficient and to have that skill set, you have to do more reps. In training, they can only show us and teach us so much, but once you get out into practice, you do a surgery, let's say you do it 50 times or 100 times or 200 times, there's gonna be some mistakes along the way. You may have one or 20 good surgeries and one patient has a complication from a nerve injury, they have a bleed or infection or leakage. The most important thing is how you respond to those complications, how you manage them. That's, to me, is a sign of a great surgeon. And also the fact that a surgeon knows when to operate and when not to operate. I think a surgeon is a great surgeon when he is able to do those two things. Know when to operate, know when not to operate, as well as know how to handle and manage the complications that you may come across. You're gonna have them in your career if you wanna be a surgeon. You're gonna be a doctor, you're gonna have complications. It's all about how you handle them. So yes, of course, we get complications, we get infections, drainage, hardware irritation, the screw may pull out of the bone and you have to take the patient back to surgery. Patients with continued pain, you have to know how to manage those complications, and this comes with experience. So a person that tells you, oh, I don't get any complications, I will never get one, that's a lie. They're not operating enough and they're telling a lie. So we get complications as surgeons, things that can go wrong, mistakes are made. Sometimes, it's not our fault as surgeons, it's just working in certain type of environments that are high risk. Unfortunately, that's what we do as spine surgeons and as orthopedic surgeons. So thinking back to, let's say, a mistake that I made, as I mentioned, repetition, going through the reps, going throughout my training, I have seen and really have appreciated the fact that my comfort level with surgery, doing the surgeries on my own, and my skill set has increased dramatically. The complication rate goes down. There's some studies out that look at the complication rate when you first come out of training, maybe up here. As you go through your career, it goes down. At the end of your career, it goes back up again. So one mistake that I've made, patient with very severe stenosis or narrowing of their spinal canal. As I was taking the pressure off of the end of the spinal cord, the spinal canal, I had a tear in what's called the dura, which is the outer covering of the spinal canal. And inside of the spinal canal are nerve roots and there's spinal fluid. It's like a balloon with a lot of nerves in it. So what happens is if the patient has very severe stenosis and it's stuck down to the dura, you're taking the pressure off of it, you're using instruments to bite it very carefully, then there's a tear in it, your spinal fluid leaks out. So that's one recent mistake that I've made, and I've learned to effectively decompress a patient's spine and their canal with less dural tears. As I mentioned, as you come out of training, you're doing these surgeries by yourself. You saw your mentors do it, but you're doing it by yourself, and as you go through your career, you get better, more efficient, less complications. What we do for that, we identify the tear, we find it. If you have to make a larger incision or widen your decompression, take more bone so that you can see and actually put a suture in it. So that's what we do. It's a very small suture. You have to usually wear loops to actually see it. It's very small. And then you suture it together, you put a patch over it, some surgical glue, and then you check it to make sure there's no leak. We call it a watertight seal. So that's one complication or mistake that I have made. As a surgeon, you analyze your mistakes. You think about it. What could I have done differently? What can I do to improve and better myself in the future? So that's what makes a good surgeon. Watching an NBA series where Jimmy Butler decided to take a three-pointer at the end of the game, tried to win the game, and he missed. That was a mistake. He should have drove in, tried to take it up and get fouled. But as a leader, as someone who's a professional athlete, they make mistakes too. So these things happen. Unfortunately, they don't happen a lot, but you have to be mindful. There's litigation that can happen. There's lawsuits and people become injured. And that's just the risk that we take as physicians. So just wanted to make a video about this. I get this question a lot. For the future students out there, doctors, you're going to get them. It's going to happen. Most importantly is how you manage and how you react to it. Not only in that type of environment, how are you reacting? Are you yelling? Are you screaming? Are you freaking out? Oh my God, oh my God. Well, you don't want to do that. Keep your composure. You've seen this before. You can do it. Repair it. Tell the patient about it. Be honest. Be upright. Say, hey, we had a dural tear. I was able to repair it. It doesn't affect your outcome anyway. You're going to do great. We're going to get you through this. So this is Dr. Webb. Thank you for watching. We'll see you next time.